specifically specialized in environmental health issues.
Okay.
We have been working at global level for the last 25 years, specifically doing risk mitigation activities, trying to reduce the risk of exposure and poisoning from different toxicants. In the last 5 years, we have clearly focused in lead and mercury, because we consider there are the two pollutants having the most of the impact in terms of human health, and because we consider should be a priority for the international community. So we are working in Ghana in these two pollutants, and at the same time we are working in another 12 countries, more or less developing the same kind of activities related with lead, mercury pollution among human health.
That's a very interesting topic to, begin with. And so far, how has the study been? Especially, let's bring it to Ghana here, where we know there are a lot of factors that is making us exposed to these very toxic things like the mercury and the lead you mentioned. So throughout, what you have studied and what you have looked at, let me just come to Mr. Reverend Quansah. What have you found? What have you seen so far? What can you say about it?
Right, thank you very much once again for having us. So Pure Earth has been working through authorities since 2007, where we had a partnership with the EPA and the Ministry of Environment to put a spotlight on the e-waste situation in Agbabroshi. There was a study that was conducted with our partners then, and then through that study, we decided to partner the government to provide metal strippers to avoid people burning copper wires, which release toxins into the atmosphere and into the soil. Apart from that, we've been collaborating with the EPA in particular, implementing a toxic sites identification program. So across Ghana, we've been mapping out and identifying toxic sites that require interventions. I think we've identified close to 141 toxic sites.
Wow.
Across Ghana. There are many more to be discovered. Aside that, we've been partnering government, building capacities, around the issue of lead and mercury poisoning, as Gabriel mentioned, in the last 5 years. We've implemented a project with UNICEF and Ghana Health Service. And for the first time, we've conducted blood lead level measurement in 3 ecological zones of Ghana to ascertain what is the situation of children living around the ULABs, used lead acid recycling areas, based on the toxic site work we've done, identification program work we've done. And the study revealed that about 53.5% of children living around these areas had higher lead levels that required some attention.
In their system?
Yes.
Already?
Yes. And Pure Earth and collaborators also did another study to identify what are the sources. So, the blood level measurement was done by Ghana Health Service that identify some elevations of heavy toxins in the blood of the children and the 5. Where are they getting it from? So we've identified other environmental media, for example, the soil. What are they playing with? Where are they getting these things from? And so, of course, that study also revealed that some consumer products, like the chilo, which is usually used on children in some parts of Ghana, is one of the mathematically proven theories that links to high lead level measurement in children. And so, in generally, we've been working a lot with the Ghana Health Service, EPA, to address the issue. We're not just doing research and gathering evidence, but also working to develop solutions to some of these things that we've done. For example, in the mercury front, we are also working with EPA, with funding from the British government, to undertake what we call the mercury impact assessment, to understand what is the impact of mercury pollution in the food chain. That project is currently ongoing, and I'm sure there'll be learnings from that project that we could use to design interventions with government to address the issues comprehensively.
Okay, you earlier mentioned that we have about 53% or over 53% of children who had mercury in their system. Lead rather in their system. I just want to know, how was the research conducted? Was it across the country, a particular region? I just want to know a bit more. that?
That's
because it's
a very
critical.
good question. So it was conducted in 3 ecological zones. Greater Accra is one of the areas. So we're looking at Pong, Afienya, Ashamai, and Amasamai. So Pong and Afienya serve as the study areas, and the control areas are Ashamai and then Amasamai. And then when we go to Ashanti region as well, we've done in 4 districts. 2 districts serve as the study areas, and then the other 2 controls. And the northern region, we did it in 2 districts, Yendi and Tonon. So it's 3 ecological zones around areas where we've already, work we've done, identify some toxic areas, the activities of use-lead acid recycling, for example, the informal sector activities of this use-lead acid battery, which release pollution into the environment. So these are the areas. But for the northern region, the situation was different because we did not quite have any active toxic sites around. So we were very surprised that almost 80% of the children that were assessed in both the study area and the control area had elevated blood lead level. But like I said, we are working with authorities to design solutions to address the issues.
That's a good one. So, Mr. Sanchez, let me come to you. Since you earlier mentioned that you are working with in various countries in the world or in Africa. Is it in
both in the world? In
the world. Wow. So I just want to pair the research that you have been having across the world, comparing it to Ghana. What are we really not doing right, or what can you observe? Because it looks like a very critical issue in Ghana with the statistics that I'm receiving from Ms. Reverend. And so what do you think we are not doing right, and what can be done as a prevention and also management, or even a cure in the first place?
Thank you very much. An important characteristic in the domain of lead poisoning is that in different countries we normally find different sources of exposure. This is the reason why it's so important to carry out epidemiological studies, as we did with Ghana Health Service, in order to determine the blood lead levels among children, and after that try to identify as well the kind of source of exposure that are contributing the most to this lead poisoning.
Right.
Different countries, I repeat, have different sources of exposure. For example, we have been working in places like the Republic of Georgia, or for example in Bangladesh, where the adulteration of spices with lead was a very, very important contributor to lead poisoning, which is not the case, for example, here in Ghana. Specifically for this country, the kind of sources that has been identified as potential contributors for this lead poisoning has the ones that Dr. Quansah has already mentioned. There is, of course, unsound management and recycling of lead-used acid batteries that are releasing lead to the environment, contaminating the soil, and directly affecting children's health. But there are other kind of consumer items that we know as well could be contributing to lead poisoning. He mentioned some of them. Cosmetics in some areas, the use of metallic cookware locally produced for cooking, others such as imported toys, etc. The most important now is to try to identify with the government what exactly these sources are and in which extent they contribute to lead poisoning. Why? Because as you know, lead has no therapeutic solution. When you get lead in your body, it's very costly, very complicated, and normally inaccessible to get the normal medicines and therapeutic measures in order to reduce this. So the best way of fighting lead poisoning is through prevention. This is the reason why I'm here now. Ghana government has shown an enormous level of leadership in the last years around lead and mercury, both pollutants. For example, Ghana is member of the Minamata Convention, is signatory of the Minamata Convention, trying to phase out mercury, use of mercury in different products, but specifically in mining. And recently, Ghana government has joined the Partnership for a Lead-Free Future, which is a big platform at international level. What we are trying to do now here is to negotiate and to support EPA, Ghana Health Service, and other relevant governmental agencies in order to work with them, along with them, in the implementation of regulatory measures and enforcement measures, trying to guarantee that these consumer items presenting high lead concentrations are better regulated and better controlled and better monitored in order to reduce the lead presence in these consumer items and consequently not poisoning the families and the children in
Thank
Ghana.
you so much. That was I love the regulation part and how you are working together with certain bodies across the country to ensure that this is best prevented and also worked around. But I know that there is going to be an event today around 12 with the EPA. Just a little briefly before we leave, a little bit of light into that, then we go out of here.
Thank you. I think one of the reasons Gabriel is in town is largely to help in launching that event.
Okay.
Following the work we've done with the state actors, the evidence we've gathered from the research we've done, what we've seen, our donors are supporting us to launch a project that will be implemented over the next 3 years. The purpose of that project is to identify gaps within the regulation and then develop mitigation measures to address them. Yesterday, for example, we met with the Ghana Standard Authority, who is an implementing partner.
Okay.
And we're exploring ways that some of the adulterated consumer product in the market, for example, can be regulated. So that is a huge breakthrough for Ghana. Ghana is part of the other 7 countries who will be implementing this project, and it's a win for Ghana. And I'm happy to have Gabriel to be part of this huge launch. It's a collaboration between Pure Earth, EPA, and Ghana Standard Authority.
Wonderful. So it's happening today?
It's happening today at Ibis Star Hotel. Yes.
Ibis Star. Exactly. Okay, and wish you all the best in their launch.
And I want to indicate that Professor Brown, Klucher, is the keynote speaker.
Oh, okay.
And she's demonstrated enormous support for our initiatives. And we're very grateful to the Ghanaian government and its agencies always working with that. Okay. Our mission is to partner government, academia, and institutions like yours to address the issue of heavy metal pollution and poisoning that is affecting children the most.
Okay, thank you so much for the much education on these toxic environmental things that are going on in the country. We thank you for your time. But we'll be doing our last cash out here. If you did not